Over the past 28 years, throughout the world, Gateway has raised $85 million for cancer research, funding over 170 clinical trials, impacting 5,500 patients. In pediatric research alone, Gateway currently supports 16 clinical trials covering 750 children at hospitals across America. And at Phoenix Children's Hospital, Dr. Cynthia Wetmore is conducting a trial with young patients suffering from a brainstem cancer, known as DIPG.
Pontine glioma is a very deadly type of brain tumor that strikes the brainstem of young children. The only type of therapy that helps these children is radiation therapy. They get radiation for 6 weeks, and then they celebrate. They get to ring the bell like many cancer patients do when they finish therapy. But unfortunately, these kids, it's not a permanent fix and completion of therapy, because we know that the radiation therapy is palliative, meaning that in every case the tumor will come back. It comes back savagely, and it robs them of their ability to often swallow, to speak. Their eyes are not able to face straight ahead, and it's really quite devastating because it affects their whole body and their ability to function. Families are always devastated by the news that their child has an inoperable brain tumor and that there is no long-term cure. But the only way I can get through the day and do my job is to know that we're bringing hope to these families. And so I've committed my career, more than 20 years, to working with families, bringing new therapies to clinical trial, trying to bring the next step in advancement that will help improve the quality as well as the quantity of their life. Gateway came to visit me, and I was honored and surprised and thrilled to receive word back in February that the study was going to be funded by Gateway for Cancer Research. It's a very new, innovative technology that was developed in conjunction with Dr. Stephen Johnston at Arizona State University. And this is a novel approach to actually trying to reveal the tumor to the immune system so the patient's own body can fight their tumor. This has never been done in any pediatric or adult tumor. We know that it has great promise. We know from studies in the lab that this type of therapy can be quite promising for other types of cancer, though it has never been run in a clinical trial. Therefore, I'm approaching the FDA. While this has not been tried in 60, 70, 80-year-old adults because they don't get this type of tumor, we give the first shot to our children who have no other hope and desperately want to try this new therapy. Every room in our hospital looks out on the mountains, and the sun rises from every area, which I think is therapy for the families. We want to have therapy so that our families don't have to travel across the country or across the world for therapy. We want to be able to keep our families in their home and church and neighborhood communities so that they don't have to leave their jobs and leave their other family members and their support system. We want to keep our Valley patients right here in the loving arms of their friends and communities so that we're better able to heal them, because when the person is whole and the family is supported, that's when the children do best.